Ketamine is a safe drug. Ketamine is a safe drug if it's used responsibly, if it's used in the right setting. It has tremendous potential. Ketamine has been used in many different clinical settings, and it is safe in those settings, and it's safe as well in the treatment of mental health disorders. When ketamine is used in a safe and responsible way, in the setting of a clinical practice with guidelines, with correct dosage, correct formulation, it's safe. It's a safe drug that has tremendous uses and applications in the treatment of mental health disorders. And when I say safety, I mean things that include screening people who are appropriate for ketamine and those that are not. Contraindications to ketamine include conditions such as psychosis that is active, untreated, conditions that involve the heart and the lungs, elevated pressure in the brain, if you have an aneurysm in the brain, if you have severe cerebrovascular disease, those are contraindications. Obviously, allergies to the drug would be a contraindication, but that's quite unheard of. In the setting of ShaMynds, the goal is to screen people appropriately, make sure that they are not entering into this space in an unsafe way. So in our initial screening process, we make sure that we are approaching the therapy or the use of ketamine in that safe way, addressing all the medical conditions and the psychiatric conditions that could be contraindications for the use of ketamine. So there's been an explosion of research in the last 10 years and perhaps even a little more than 10 years around ketamine and its use in conditions such as treatment-resistant depression, conditions such as PTSD, obsessive-compulsive disorder, pain, even use in substance use disorders such as alcohol or chronic opioid use. So a tremendous amount of research that's emerging that is very, very promising. If we think about where we started off with the strength of the SSRIs, which we were using for many of these conditions for many, many years. And over time, what we found, especially in some groundbreaking studies as of recent, we've discovered that many of these therapies, such as the SSRIs, are no longer beneficial. They actually have very, very low efficacy rates, meaning they only really help less than 1/3 of the people who are actually on these medications for conditions such as depression, obsessive compulsive disorder, PTSD, even psychosis, schizophrenia, bipolar disorder. And so we've seen the limiting effects of those. And what's happened is there has been subsequent research actually on people, real life people who are experiencing these conditions. And what we found is that the efficacy is even lower than what we thought. So what does that do? It takes us out on a journey to find other forms of therapy that can help people. And that's where the psychedelics hold promise, is their immense, almost sometimes immediate benefit to patients when they seek this therapy. In fact, sometimes you can see a major breakthrough even after just one session, and that's not unheard of, and it's astounding when it happens, but it still needs the support, it still needs the integration, still needs the ongoing development of self and transformation. There are studies out there that say that some of these psychedelics that are being studied have almost a 70% efficacy. So if you think of something that is only 25 to 27% effective to something that's 70%, imagine the healing, imagine the transformation of people, the transformation of their communities, of their families, and what can be done to heal this world.